Hello and welcome to Stop Norovirus in Childcare. My name is AnneMoyer and I'm a childcare health consultant in northern Colorado. I am going to be speaking to you today about norovirus, how norovirus spreads, and how we can best stop the spread of norovirus in childcare centers. What is norovirus? Norovirus is the leading cause of gastroenteritis in the United States. Gastroenteritis means that your stomach and intestines are inflamed. So with that, you see vomiting, diarrhea, stomach pain, and bloating. It's extremely contagious, needing less than 20 microscopic particles to infect a person. So you can imagine less than a pinhead of particles can make you sick. It also lives outside of the body for 2 weeks, so it sticks around on everything it comes in contact with, making it even more dangerous. Finally, it mutates every 2 to 3 years. When you usually get sick from a virus, your body starts to recognize the virus, and so in the future, when you come in contact with that virus again, your body knows how to fight it off. When a virus mutates, your body is unable to recognize it in the future, and so it allows you to get sick from the same virus over and over and over again. How bad is norovirus? Each year in the United States, there are 21 million cases, 71,000 hospitalizations, and 27 children under the age of 5 die. According to the NCIRD Division of Viral Diseases, by the time they are 5 years old, 1 in 14 children will have gone to an ER because of norovirus, and 1 in 278 will be hospitalized. Why should we worry about norovirus in childcare centers? I have a feeling you're probably already starting to imagine why. Children under the age of 5 increase the risk of the disease spreading. First, young children come in close contact with both adults and other children. And second, young children don't have the best hygiene habits. You can ask them, oh, where should you cough? And they'll say, I should cough in my elbow. But then when you're watching them cough, they don't generally cough in their elbow. They also don't think to rush to the toilet to vomit. They just vomit where they are. So they're very good at spreading disease. Then you have the issue where both staff and children are getting sick from them. We, the staff members, are the ones who are changing the diapers, cleaning vomit, holding the children over the trash can as they throw up while waiting for mom to come get them. So we get sick too. And for me, anyway, that's the biggest motivator to stop the spread of norovirus, because I don't particularly want to have vomiting and diarrhea. And finally, outbreaks can cause center closures. Once staff start getting sick and children start getting sick, you have rooms close, and then if it's not contained, the whole school or childcare center can close because you may not have enough staff, or the outbreak may just get out of hand and the health department may tell you you need to close. During today's class, we're going to learn many things about norovirus. But in order to be considered successful, you need to identify 3 ways norovirus can spread, name 1 disinfection product that kills norovirus, and take 3 of the many steps to vomit disinfection and put them in order. Norovirus can travel in a variety of ways. First, you can get it by being in close contact with an infected person, especially if you share food, glasses, or utensils. Second, when a person vomits, some of the vomit turns into a fine mist and floats around. If it gets into your mouth, you can get sick. It can also land on objects and surfaces all over the room. Third, you can directly touch the vomit or feces, and if you do that, you can carry norovirus particles to other objects. And once you've contaminated other things like a doorknob, someone else can touch that doorknob and carry the norovirus around with them also. The worst is if you touch a contaminated surface and then touch food. As we will talk about in a minute, you can try to protect yourself all day by hand washing, disinfecting, that sort of thing. But if somebody has touched your food, there's really not much you can do. To get sick, the norovirus particles have to get into your mouth. If your hands are contaminated, you can wash them to get rid of the particles. Remember to wash thoroughly with soap and water, scrubbing your hands for 20 seconds before rinsing with water. Also, try to dry your hands with a paper towel, as you may not know how clean a cloth towel is, and you don't want to get contaminated that way as well. It's also important to stay home when you are sick and for 48 hours after symptoms disappear. It's really important to not prepare food for other people during those 48 hours because food contamination is one of the easiest ways to make other people sick, as I was saying in the last slide. Children should be excluded for 48 hours after the last episode as well. People still have the virus in their stomachs and intestines for 2 weeks after symptoms go away, so you need to do a really good job of hand washing when you go back to work, especially after using the bathroom or before serving food. Remember to help the children wash their hands more often after being sick as well. If you're working in a room where a kid gets sick, don't float to other areas of the center. You could easily trail vomit and feces particles everywhere you go. Remember that vomit turns into a fine mist, so even if you wash your hands, you may be carrying it on your clothes and shoes. And finally, disinfect, but we will get to that on the next slide. When looking at norovirus disinfection, these are the top 3 things that we miss when norovirus hits our centers. There are many disinfectant options in the market these days, but not very many work against norovirus. You've probably seen products with labels that say, kills 99.9% of germs, but you know what they don't kill? They don't kill norovirus. The cheapest, most effective thing against norovirus is bleach. Sometimes bleach will damage certain surfaces though, so the EPA has a wonderful list of other alternatives that you can use, listed just below the 3rd point here. The list is tricky because the product names aren't kept up to date, but the EPA registration number is the important part that you have to look at. So what you do is if you go to a store and pick up a product, you can look at it and see if it's registered with the EPA, and if it also specifically says this product kills norovirus, then there's a good chance that it is in fact effective against norovirus. Another thing to talk about with bleach is bleach wipes. The bleach you use against norovirus needs to be a certain high concentration, but the concentration in wipes can vary, so we generally don't recommend wipes unless, again, they are on the EPA approved list. Third is that we need to disinfect more surfaces more often when norovirus is going around. We need to make sure that we're disinfecting hallways and staff areas as well as the classrooms. We should especially focus on things that many people touch, like light switches, doorknobs, handrails, even the handle to the staff refrigerator. Each of you should have received a copy of Appendix D, Disinfection Procedure for Vomit and Fecal Accidents. I'm going to quickly go through the first half of the steps with you. The first thing you need to do is remove children from the accident area and, if possible, get them out of the room. As we've talked about before, vomit particles may be floating into the air, so it's especially important in that case to try to get them out of the room. But I've noticed in the last 2 vomit episodes that I've witnessed that both of the children happened to throw up right next to the door. So if you would need to take the kids through the vomit area in order to get them out of the room, it's better to just keep them in the room and move them as far away from the accident as possible. Next, you'll need to get a spray bottle of high concentration bleach solution. We generally recommend that these be made fresh daily. And then the person who's going to be cleaning the area needs to put on disposable gloves and a mask at minimum. And if they're available, it's also good to wear a gown and eye protection. At this point, you should take the disinfectant solution and spray it directly onto the vomit or feces and make a nice pool of bleach to completely cover the accident, and then place disposable towels on top of the pool and allow the disinfectant to work for 10 minutes. At this point, I don't know about you, I would probably end up taking off the gloves and the mask and washing my hands and doing something with the children for 10 minutes before coming back, putting on new gloves, putting on a new mask, and then continuing the process. You should use the disposable towels to pick up all of the contaminants. So if your first set of towels doesn't get all the contaminants, continue to use as many towels as you need in order to pick everything up. And take the contaminants and towels and put them all into a trash bag. Then spray the disinfectant solution onto the surface again and wipe it down with clean disposable towels, and take those towels and again put those into the trash bag. And finally, spray the disinfectant solution one more time onto the now clean surface and allow it to air dry for at least 1 minute. At this point, you can carefully remove the gloves, mask, and then, if you have them, gowns and eye protection, and dispose of these properly in the trash bag. Continuing with our process of disinfecting vomit and fecal accidents, you have a trash bag of contaminants, and you should take that bag and place it into another trash bag to nicely double bag it and immediately take that to the dumpster. When you return, you should wipe down doorknobs, handrails, light switches, faucet handles, anything that is often touched in the room with bleach disinfectant solution. You don't have to be quite as thorough as you were with the vomit itself, but you should still follow the manufacturer's guidelines for disinfection with the solution. At this point, and in many of the previous points as well, you should wash your hands as you should have washed your hands anytime you removed gloves. And then you should rinse disinfected objects that children may chew on or put in their mouths. And you should also air out the room until the bleach smell is gone. There are a few other things on this handout talking about laundering anything that you can launder in hot water. If you aren't able to spray bleach directly onto something, you can launder it. Or for carpets that you don't want to bleach, you can steam clean the carpets for 5 minutes at 158 degrees Fahrenheit or 1 minute at 212 degrees Fahrenheit. At this point, we've gone through all the information that we talked about in our goals earlier. We've discussed the ways that norovirus spreads. We've talked about the disinfection product that we prefer to use for norovirus. And we've also gone through the entire vomit disinfection process. So these are a few key reminders for things that we've talked about previously. The most important way to stop the spread of norovirus is to keep all sick people home for 48 hours after the symptoms have gone away. The second thing is, anytime you have a vomit accident, you should disinfect it as if it's norovirus. And finally, the best way to kill norovirus is to disinfect it with a high concentration bleach solution. Now we are going to go through a few practice questions for norovirus. The first one, which of the following is not a way that norovirus can spread? A, vomit particles can release into the air and enter people's mouths. B, an infected person can contaminate a doorknob. C, a person can be stuck by a dirty needle. Or D, feces on a diaper changing area can transfer the virus to an infant's hands. The answer is C. A person can be stuck by a dirty needle. In order for norovirus to spread and for a person to become ill, norovirus needs to get into their mouths. So a dirty needle is not the right answer. Practice question 2. Mark all the disinfecting agents in the following list that kill norovirus. Bleach, Clorox disinfecting wipes, Lysol Power bathroom cleaner, any solution from the EPA approved list. The answers are bleach and any solution from the EPA approved list. Clorox disinfecting wipes don't have bleach in them, and Lysol Power bathroom cleaner also does not have bleach in it, and they are not on the EPA approved list. Practice question 3. Place the 3 real steps to vomit disinfection in order. Use soap and water to clean vomit before disinfecting. Put on gloves and a mask. Spray bleach solution directly onto vomit. Wait 10 minutes before wiping with paper towels. The answer is the first step is the false step. The second step is number 1. The third step is number 2. And the fourth step is number 3. In this case, we're discussing using soap and water versus using spray bleach solution. And we just learned that spray bleach solution is what we need to spray directly onto vomit, as opposed to using soap and water to clean it up. Here we have page 1 of my references, and here we have page 2 of my references. Thank you all for listening to my presentation. Does anyone have any questions at this point?